Top health benefits of sauna: relaxation, detox, and heart health. Sauna is a heat therapy that has been used for centuries, particularly in Nordic countries like Finland. It not only provides relaxation but also offers numerous health benefits. Below is a comprehensive explanation of the benefits of sauna, how to use it, and important considerations. Benefits of sauna: relaxation and stress relief. Relaxation and stress relief. The heat from the sauna helps relax muscles and stimulates the release of endorphins, the feel-good hormones. The calm environment of the sauna also helps soothe the mind. Improves heart health. Improves heart health. Sauna sessions can enhance blood circulation and improve blood vessel elasticity. Some studies suggest regular sauna use may reduce the risk of heart disease. Detoxification. Detoxification. Sauna induces sweating, which helps flush out toxins from the body through the skin. Boosts immune system. Boosts immune system. The heat from the sauna can stimulate the production of white blood cells, helping the body fight infections. Aids muscle recovery. Aids muscle recovery. Sauna can reduce muscle soreness and speed up recovery after exercise by increasing blood flow to the muscles. Promotes skin health. Promotes skin health. Sweating during a sauna session helps cleanse pores and improves blood circulation to the skin, giving it a healthier glow. Supports weight loss. Supports weight loss. Sauna can boost metabolism and help burn calories, although the effect is minimal without a proper diet and exercise. Improves sleep quality. Improves sleep quality. The relaxation from a sauna session can help you sleep more deeply. How to use a sauna preparation. Preparation. Drink plenty of water before entering the sauna to avoid dehydration. Shower beforehand to cleanse your body. Duration. Duration. Start with short sessions, 5-10 minutes, if you're a beginner. Gradually increase the duration to 15-20 minutes as your body adapts. Position. Position. Sit or lie down on the sauna bench. Sitting is recommended as heat rises. Temperature. Temperature. Sauna temperatures typically range between 70 degrees Celsius to 100 degrees Celsius. Adjust according to your comfort level. After sauna. After sauna. Cool down gradually by taking a cold shower or dipping in a cool pool. Rehydrate by drinking water to replace lost fluids. Important considerations: avoid sauna if you have medical conditions such as heart disease, low or high blood pressure, or are pregnant. You are on certain medications or have consumed alcohol. Don't overdo it. Don't overdo it. Spending too long in the sauna can lead to dehydration, dizziness, or even heat stroke. Use a towel. Use a towel. Always sit or lie on a towel to maintain hygiene and avoid direct contact with hot surfaces. Listen to your body. Listen to your body. If you feel dizzy, nauseous, or uncomfortable, exit the sauna immediately. Don't go alone. Don't go alone. It's advisable not to use the sauna alone, especially if you're a beginner or have health concerns. Types of saunas: traditional sauna, Finnish sauna. Traditional sauna, Finnish sauna, uses heated rocks with water poured over them to create steam. High temperature with low humidity. Infrared sauna. Infrared sauna, uses infrared light to heat the body directly. Lower temperature, 40-60 degrees Celsius, but equally effective. Steam room. Steam room, uses steam to create high humidity. Lower temperature, 40-50 degrees Celsius, but very humid. Conclusion: sauna is a therapeutic practice that offers numerous physical and mental health benefits. However, it's important to use it wisely and pay attention to your body's signals. If you have any health concerns, consult your doctor before using a sauna. Enjoy the experience and reap the benefits.